Now we move to item 3, the public forum, we have Dr. Ramon Pink, Medical Officer of Health, and in fact the Medical Officer of Health who's leading communications around the measles issue. Ramon, we're delighted to have you with us this morning. I think this represents an excellent opportunity for you to share your key messages and your knowledge with councillors and also with the wider community, bearing in mind that this meeting has been live streamed. We've set aside 10 minutes. My understanding is that you're going to give us a short presentation, then allow some time for some questions as well. Thank you.
Thank you for the opportunity to speak to this forum this morning. I'm going to give you a very brief, there we go. Sorry. I'm going to give you a very brief overview of what's happening, some of the challenges that we're facing, and then give opportunity for questions. I'll speak to the features of this illness, what our current situation here is in our city, and then some of the challenges. Measles is a virus illness. It is highly infectious, and that is a very key feature, and it is passed on by what we call droplet transmission. So coughing, sneezing is the way we infect others around us. That's an important aspect of this illness. It means it travels quickly because of its high infectivity. Some of the features of the illness you'll likely be familiar with include a cough, or coryza, runny nose, or sticky eyes, conjunctivitis. Fever, high fever, is a particular feature of this illness, and I think we're all aware of the rash that is associated with measles. We call it a maculopapular rash, which starts around behind the ears and the face, travels down to the trunk and onto the limbs. Another aspect of the measles which we may not be familiar with is the spots in the mouth. We call them Koplik spots, and they appear during the high infectivity phase of the illness, which is usually 2 to 4 days after the illness has started. The illness incubates within the body on average for around 14 days before it declares itself, and we call a prodrome that early phase of the illness, and this occurs prior to the onset of the rash. The rash typically appears as I've already described, and from the time when the rash appears, fever is usually high and the individual is really unwell. I don't know if you've had measles, you may recall it from your childhood, but it is not pleasant at all. And infectivity is from 5 days prior to the rash and 5 days after the rash appears. The measles has often been considered as just a childhood illness of no concern. However, it does have complications, as those noted on your screen at the moment, and we have to be reminded of the fact that it is potentially a fatal illness. Significant outbreaks that are occurring overseas at the moment have seen high rates of significant rates of mortality, and so I think it's important to be reminded of that. But typical complications are infections of the ear and pneumonia. Encephalitis, which is infection around the brain, is the ones particularly that can cause long-term complications and indeed death. This is a picture of the current situation here in our city. At the time of speaking, we have 28 confirmed cases. Of those, a majority are of New Zealand European ethnicity, and the significant group showing up in our confirmed cases are those aged from 5 years to 28 years. The next group after that, which is only half that number, is the age group of 29 to 50 years of age. So what are the challenges that we're facing currently? Obviously, our efforts are going to go into vaccinating that part of our population that is not vaccinated. We know that the measles, mumps and rubella vaccine is a very effective vaccine. For those who receive the vaccine, 95% of them will mount an immune response which will protect them against the measles, and that is a very important feature of the vaccine. One of the challenges which you may have heard of is the supply of the vaccine, and the supply of the vaccine in this situation is a challenge. This is not business as usual, and the vaccine required for this outbreak is significant. Transport of the vaccine to Christchurch, and then from the storage warehouse out to practices, and then from practices to individuals, requires a steady temperature to ensure that the vaccine remains effective, and that is a logistical challenge which has caused a delay in getting vaccine supply into our city. Measles is what we call a propagated infection. It means that we can have a group or a cluster that become infected, and then several days later we may get another group or cluster infected, and that's because of the incubation period I mentioned to you before. So mounting a sustained response and a coordinated response, because of the many moving parts, is a challenge, and we are working very hard on that at the moment. Just when we thought that was enough, of course, we have the flu season just around the corner. We do have cases of influenza already identified in our community. That is early. The flu season officially begins on April 1, and so the supply not only of the measles vaccine for this outbreak has to be also considered with the supply of flu vaccine as well, and so that's also something we're needing to juggle, and we are planning around. I think I will leave it there, and I'm very happy to take any questions from the floor.
Yep, that's fantastic. Thank you very much indeed. So we will take some questions. So I've got Jamie and Dion. Jamie.
Thank you, Dr. Pink. That's very helpful. Look, in a situation, if you had an 18-month-old baby at home who's had one vaccination and a heavily pregnant wife due any day, vaccinated once as a child, what would you advise these people to do? Asking for a friend.
Indeed. Thank you for your question. It's a common question. As I think the key to your question is the fact that we believe our vaccine does provide immunity for 95% of our community who have it. So in your situation, it's good to hear that the 18-month-old child has had the vaccine, clearly had it on schedule. We know that for pregnant mums, it's good to hear that this pregnant mother has also had a history of the vaccine, and that does afford her immunity. There is a risk for pregnant women, we know, because the vaccine is what we call a live attenuated vaccine. It has live virus in it, so pregnant women will not be given the vaccine. However, if a pregnant woman is exposed to a confirmed case, she will be able to have immune globulin. There's a window of up to 6 days where she will be, through her lead maternity carer, her midwife, will be offered the immune globulin, and that will provide her with passive immunity, which will protect her through the period of the outbreak.
Okay, so I believe in this situation the father was also vaccinated.
It's very good news.
But would they, such as the father, would he seek to have a booster shot, perhaps?
I would say to this father, no, that they wouldn't require a booster shot. In fact, the measles vaccine, we have when we say you need 2 vaccinations, the reason why we have the second vaccination is for that very small number, or 5%, who don't mount a response after the first vaccine. So it is really a belt and braces approach for covering off our whole community. But if that father has had his 2 vaccinations, he is well protected.
Thank you for that, and thank you very much, to you and your team for the information flow. It's really helpful.
Thank you.
Thank you. Anne.
You can send him the bill later, Raymond. A couple of questions. Firstly, is the vaccine free?
The vaccine is free, yes, indeed.
And secondly, if a parent is worried about a child, what is the best pathway for them to follow?
The best pathway, I would, under normal conditions, I would say call your general practice. General practices are very busy at the moment. The message that we're giving to the community is the one that I've just given to you now, in that if your child has already had one vaccination, then there is strong immunity conferred on that child. Our target audiences are the 12 months to 13-year-old who has never been vaccinated. We are using that age group because our National Immunisation Register, established in 2005, covers that group, and we can identify the children in that group very quickly and clearly and target our vaccine toward them. The next group is the 14 to 28-year-old group, the adolescents and young adults. That group is a little less easy to understand their immunity, but typically we have seen that this group is the one where we see the most cases, and that's the case in our Christchurch outbreak. The significant proportion of our cases are in that age group. That age group, for a number of reasons, has a lower immunity. Some of you may have heard of the Wakefield report back in the late 90s. It linked measles to autism. That has been discredited a number of times, and most recently from a significant Danish study. And so that group whose parents will have said, no, we don't want the vaccine, we are going back to that group and suggesting to them that it would be a good time to get the vaccine. And that's where our efforts are also being focused. So those are our two priority groups.
Thank you. Now, we are at the 10-minute mark, but I will take a couple more questions, one from Dion, one from Phil, and that will be all the time that we've got for answering questions this morning. So, Dion.
Yeah, mine's really just around there's a few people out there who are a little bit concerned about only having one shot.
Indeed.
So they're asking why are we only finding that out now around the 95% and how they didn't get one earlier. And that leading to people worried about what's next. So in the communities, people are saying, well, do I stay home or do I go out? Just maybe just a little bit of an update around that, so just people can get an idea of where they can do and what they can do.
Indeed. Certainly our communication around having two vaccines is for the reasons that I've already given. I think that it's understandable that the community may be concerned that they've only had one vaccine, but I hope that the message that I've given to you today and that we are giving to our community is that it does confer significant immunity, and we'll continue to put that message out. It's very important to recognise that business as usual continue in our city. Public health is targeting confirmed cases or cases notified to our office on suspicion. When those individuals are targeted, we will also be looking at any of their businesses, schools, any places that confirmed cases have been, and giving advice to those so that the public are aware that even though we have this virus travelling in our community, that we are targeting and therefore encouraging the public to continue as usual. The never vaccinated group is really important. We are saying for those who have never had a vaccine, particularly our young ones, that they should refrain from large gatherings. I suspect that's only a small number if we look at the demographic of our city, but that's just to give a precaution and to give advice to parents of those young ones.
Thank you. Phil.
Thank you, Ramon. Just taking it back a step, like earlier you showed some stats about where perhaps the issues were affecting different countries, but is it I'm just wondering, is one of the contributory causes the fact that a significant percentage or a higher percentage were not vaccinated, and therefore that's led to the spread of the disease?
Measles is not endemic in New Zealand, and so it's not circulating in our communities in what we would call peacetime. We have a very significant community immunity in Canterbury. We have very high coverage of our under-5s, which is part of our national immunisation schedule. And I've talked to you about the likely conferred immunity for the other age groups. We only get measles in New Zealand if we have travellers visiting or returning to our country who become infected, likely unknowingly, and then passing it on to those individuals who are not protected. And so I think I would reiterate the fact that we have a strong community immunity. We are looking at those who are the ones most vulnerable and susceptible, and that's why we're focusing on those areas that I've mentioned to you, those age groups.
Thank you.
Thank you. So you've provided a lot of information both in your briefing and in answers to questions this morning. If the community are wanting to access that information, or indeed any updates to it, either online or through other sources, how and where would they be able to do that?
The community is able to access that information on from Healthline. They're able to access it on our website at the District Health Board. There is also other websites which are notified on that website where they can get that information. They can try their general practitioner as well, but for the reasons I've mentioned, I would encourage them to go to those websites in the first instance. They are calling our public health unit, and we have messaging which directs them to those places where they can get the correct information.
Thank you. So thanks once again for coming along with the briefing and with such full answers to questions this morning, for taking your valuable time to spend this time with us, and for the work you're doing in the community at this particular time. Thanks very much indeed.
It's my privilege. Thank you very much.